it's Dr. Sheila Dobee from Your Caring Dentist. I know many of you are a little bit worried about coming to the dentist about the safety concerns. So today I spoke to an infectious control doctor who's an expert in COVID-19. He's Dr. Jake Scott, and he's from Stanford. So we're going to hear a little bit about what he has to say about going to the dentist.
Extremely important to have regular, good dental care. I think that if there's not enough attention paid to dental hygiene, it can lead to a number of complications that people might not realize. So as an infectious diseases specialist who primarily sees patients that are hospitalized with various infections, I do sometimes see patients who have various infections that stem from dental infections. And sometimes they can be very subtle in terms of the origin of the infection. It doesn't always start with tooth pain. Sometimes it's just a matter of, a sort of slowly decaying tooth that leads to a bloodstream infection that then leads to a heart valve infection, for instance. So it's very important to practice good daily dental hygiene and to have a regular dental care by a dentist. And as far as the risk of exposure from a dentist's office or a doctor's office, I think that all of us are taking so many precautions in terms of hygiene measures and sterilization measures and wearing masks. This pandemic, it's going to be here for a while, unfortunately, and I don't think that the public should postpone dental care until this is all over. I think that would be problematic.
Well, thank you for clarifying that, because I know there's a lot of people out there that are concerned about going to the dentist, and it's really important that they understand that if they have poor oral hygiene, that bacteria can get into their bloodstream and cause heart attacks and strokes and many other issues.
My pleasure. Great talking.
So Dr. Chirag, how important is it to take care of your dental health during a pandemic?
Very important to make sure you are taking care of your dental health and you're doing routine exams, just like you have to maintain your routine office visits with your physicians to check on your heart or your lungs or your blood pressure or your diabetes. Very important to maintain your routine oral health or dental health as well, because poor oral or dental health has been linked with infections in the lungs. And years of poor dental health can lead to infections in the lungs, can damage the lungs, can cause scarring in the lungs, and create whole sorts of lung problems. So very important, absolutely.
So is it the bacteria that's getting aspirated into the lungs, or is it going through from the bloodstream? How is bad oral health kind of getting causing lung issues?
There is level of evidence for both of them. Aspiration, which basically means that bacteria from the mouth will go down the throat into the lungs and cause infection. And sometimes bacteria, when it's in the mouth, can be absorbed into the blood and will circulate in the body and spread and cause infection in other parts of the body, including the heart, including the lungs, kidneys, all other places. So scientific evidence is out there to cause infection at both levels. Yeah, absolutely.
Yeah, and that's something that wasn't documented till quite recently. Like when I went to dental school, I don't want to age myself, but this was over 20 years ago. Right. We didn't even talk about oral systemic links. And now we're noticing that, it's involved in potential heart attacks, strokes, and lung health and kidneys. So it is really important for patients to go out there and get dental care and take care of their health.
Yes, absolutely. So it is something that's always been out there, but again, we are in a time, we are in a year where we have started to learn a lot about poor lung health. Again, we have started to learn that ignoring the routine health check can have a lot of long-term implications. And one of them is to just not doing proper dental care because that can again spread the infection via bloodstream and cause whole sort of problems by causing infections all over else in the body. Absolutely. Yeah.
So we should be visiting our medical doctors at least once a year to get our lungs checked.
Absolutely. Yeah.
And going to the dentist at least every 6 months and getting our teeth checked, and at least
absolutely
we've got that taken care of, healthy teeth and healthy lungs.
Absolutely.
So Dr. Bharat, do you feel that it's safe to go to the dentist right now?
If universal precautions plus other precautions are taken, it is perfectly okay to go to the dentist.
So Dr. Bharat, what we're doing in our office is we're doing a very thorough questionnaire before they even enter. We're making sure we've got social distancing with the office. They're having their masks on the whole time until they actually sit in the dental chair. And then the dentist, we are wearing N95s, and we actually have a level 1 or 3 surgical mask covering that. We have eye protection and a visor. And then we have extra oral suction devices that suck in any air, puts it through a UV filter and a HEPA filter, takes out clean air to make sure that the room is clean. And in between patients, we're also doing cold fogging. So we're doing all of these precautions to make sure that our patients are taken care of. Do you feel that that's adequate?
That's as good as it gets.
So Dr. Bharat, a lot of people are not coming in to get their dental care done because they're so worried about coronavirus, even though we're taking these great precautions and really, we've always taken universal precautions, but now we're really stepping it up and making sure that our environment is safe. Do you have anything that you can comment on that?
It's important to have good dental health. It's often a neglected thing. I feel a lot of other chronic illnesses start in the mouth, and we're well aware of dental caries leading to poor nutrition, poor health, but we also feel that there is a increasing number of peer-reviewed literature now seeming to indicate that something that happens in your mouth may have consequences far away with your arteries, with your blood circulatory system in the central nervous system, with potential associations with dementia and such diverse and far away from your mouth syndromes, which all start with your mouth. So the more we learn that actually maintaining good dental health is very important.
And especially around now where there's a key component between oral health and immunity, right?
Indeed, indeed.
Yeah, it's very important to keep your oral health up to date so that your no bacteria is going to kind of go into your system, causing potential risks of heart attacks, strokes, and also a decrease in immunity. So it is important to visit the dentist, and we are taking precautions. We are making sure that our patients are safe, and luckily, you know, we haven't had any cases in the US of dentists transmitting coronavirus to their patients or vice versa due to the precautions that we are taking. Thank you so much.
Yes, and it's very sensible and it's very pragmatic, and it is a way forward. And I think it's wonderful to see fellow dentists grasping that can-do nature and saying, we've got a way around this. And it's pleasing to see that instead of no dentistry, dentists are back up and running. I appreciate it is uncomfortable and inconvenient, but at least it's a way forward.
Yeah, it's very uncomfortable for us to practice with our N95s on, with our masks on, our shields, our glasses. I mean, we're sweating underneath there and barely breathing, but we're doing what we need to do to keep our patients safe and healthy and happy. Yeah. We have taken a lot of precautions in our dental office to make sure that it is safe for you. Not only do we have clean, safe air, we've got special HEPA filters, we've got UV filters, we've got cold fogging, extra layer of disinfection, social distancing going on, plexiglass, even more sterilization than we've ever done. We've always had the highest level of sterilization, but we've added extra protocol to make sure that you are safe. It's not just about keeping you safe, but we've got to keep our team safe. And I feel very confident that we've done a wonderful job of that. So I really look forward to seeing you soon. And if you have any questions, please don't hesitate to call us on 510-793-8515. Or you can go online. If you're concerned about coming in for an appointment, we also do virtual consultations. Just go to our website, www.dentmlc.com, www.yourcaringdentist.com, or you can give us a call in our office, 510-793-8515. Look forward to seeing you soon.